IntelliJoint Hip provides surgeons with real-time intraoperative measurements for cup position, leg length, offset, and joint center of rotation. It is affordable. The IntelliJoint Hip system consists of a miniature camera that resides inside the sterile field, a single tray of instruments, and a laptop computer. Make 2 small stab incisions on the iliac crest. Insert self-tapping screws into the pelvis and slide the pelvic platform onto the pelvic screws. A magnetic mount is used to attach the camera to the pelvic platform. IntelliJoint Surgical's breakthrough technology is encapsulated in a single miniature camera that is attached directly to the pelvis and prior to performing the primary incision as follows. Ensure proper patient positioning and register the horizontal plane by pressing the green button on the camera. You may adjust for pelvic tilt at this time. Registration is now complete. IntelliJoint Hip will now track any patient movement and report values relative to the current orientation of the pelvis. Continue with the standard surgical workflow. The camera can be removed at this time to avoid any interference. The femur platform's low-profile design minimizes soft tissue interaction during the procedure. Using the inserter, tap the femur platform onto the greater trochanter and insert the self-tapping femur screw. The femur platform spikes are designed to ensure there is no interference with the femoral canal. A magnetic mount is used to attach the tracker to the femur platform. Ensure the patient's leg is in the neutral position and capture the baseline position. Articulate the leg to capture the native hip center. Continue with the surgical workflow. IntelliJoint Hip provides accurate real-time anteversion and inclination angles while accounting for any intraoperative patient movement. Position the cup as desired. The miniature camera tracks patient movement throughout the surgery to ensure measurements are always displayed relative to the initial registration. Press the green button to save the final cup position angles to a summary screen. Continue with the surgical workflow. Perform the first trial reduction. Attach the camera and tracker and articulate the leg to capture the new leg length, offset, and hip center of rotation. Reproducing the original leg position is not required to obtain accurate leg length and offset measurements. The measurements are independent of the leg's orientation. IntelliJoint Hip will display real-time changes in leg length and offset values for each trial reduction. Perform additional trial reductions. Each trial measurement is saved in the software. All final values, including the final cup position and final leg length and offset, are saved to a summary screen.